All right, our next speaker is Stephanie Reedy. She's a medical researcher by day and a writer by night. Recent publications include essays in the Globe and Mail and Châtelet magazine. She's a regular speaker at area high schools, universities, and professional schools on the topics of mental health and suicide prevention. Stephanie lives in Halifax with her husband and her 2 sons, and she has a blog called, and it's you can find it under escapingelegance.com underlined. We can give you that later if you'd like to have that. And I'd like you to give a warm welcome to Stephanie.
Thank you. I'd like to say thank you to Mrs. Burns and the Dartmouth General Hospital Foundation for inviting me, and to Carla for organizing everything. Great job. This has been tremendous. I've enjoyed giving up my Saturday. I made a comment to Mrs. Burns that it got me out of 2 hockey practices this morning, so I was all thumbs up for that. But I really appreciate you guys giving up your Saturday morning. I think it's a really important topic, and the fact that you guys are all here really gives me a lot of hope for our future when we're talking about mental illness. So, unfortunately, I have to stand still because I'm a bit of a wanderer usually when I talk, so I'm going to stay focused and stand still and not move around too much. So, as I said, as my introduction said, I'm a research coordinator. I work at the rehab at the VG site in Halifax. Currently, I'm with the Department of Rheumatology. Prior to that, I was the ALS research coordinator for 10 years until we lost our funding, and prior to that, I worked in diabetes. So I've been a research coordinator and worked in healthcare for over 15 years, but I'm not here today to talk to you as a healthcare professional. I'm here to talk to you today because I live with a mental illness, and I have for my entire adult life, and I work full-time with the mental illness as well, so I'm here to talk to you a little bit about that. I like to start with this slide because to me this could be a drawing of me. It sort of represents what a lot of people with mental health problems go through getting ready for the day to face the world. Basically, we live behind a series of masks. And under our mask, we are feeling sick, we're feeling tired, we don't know how we're going to face the world, but we have to do it. So we put on a mask that looks happy and healthy, and we go into the world and we basically live our lives without anybody knowing what's going on. So that's what my life has looked like for a very, very long time. And I started wearing a mask back in high school, and I don't want you guys to have to strain your brain to think what I looked like back in high school, so I've included my prom photo for you there. So back in high school, what everybody saw was that I was an excellent student. I was in all honors classes in high school. I maintained A's through university. I was a very involved student extracurricularly. I was in drama. I was on councils. I was the president of the ski club. I was very physically active. I was a highly competitive tennis player in my youth. I was ranked provincially, made it to the nationals once. And I was a competitive downhill ski racer as well. And I coached my way to pay through university, coached tennis to pay for university. I had lots of friends. I mean, I wasn't the prom queen or anything, but I had a good group of friends, a solid group of friends through junior high, high school, followed me in through to university. And I had, boyfriends, not all at once, like that makes it sound, but at the appropriate intervals I had boyfriends. I was also a very attentive daughter. I grew up here in Dartmouth. I had a mother and father who did not have any alcohol issues. There was no abuse in the family. I had a sister who was my best friend, still is my best friend, and I was very involved in our family life. So my reality, though, is that I was always tired, and I thought I was lazy. My parents thought I was lazy, my coaches thought I was lazy, because when I wasn't actively doing something, I was laying down to rest. I had constant underlying headaches and nausea. I thought it was normal. I didn't know that other people didn't have to take 6 Tylenol throughout the day to get them through. I just always had this underlying sense of not feeling very well. I have a very memory of being lack of interest in everything that my friends were interested in. So the latest album that came out, or the boy that was new to school, everybody else would get very excited about things, whereas I was always kind of feigning interest in those things. I didn't have that sense that I was excited about anything. It was all a bit of a hard work to be excited. And I had low self-esteem, which unfortunately isn't unusual in young women, but I also had mild social anxiety. I didn't like to answer the phone. When the phone rang, I used to get a clench in my stomach. I would feel scared that it was going to be for me and that I'd have to talk to somebody. I didn't like to go to the mall. I didn't like to go to parties because there's too many people. Now, I still did those things, right? I'm wearing a toga, so I went to the parties. It was just a lot of effort. I had to force myself to do those things and act normal, basically. And I had a lot of sick days. And at the time, I thought I was faking sick. I just needed a break from people. And I see now that those were actually mental health days. And we use that term kind of loosely and say, I'm needing to take a mental health day. But for somebody who is dealing with mental health issues, having a mental health day is really important because it gives them time to recharge their batteries. And so that's what I was doing through high school and university when I was taking these sick days, was I was recharging my batteries so that I'd be able to go to school the next day and face everybody again. So my crisis hit in my final year of university. I was at Dalhousie, and my fatigue turned to exhaustion, and my underlying headaches turned to migraines. And I just thought it was stress. I thought I was under a lot more stress. It was my last year of my program. I was dealing with a lot of things, and I just thought this was one more thing I had to deal with. My concentration started to drop. It was a problem for me. I was an English minor and a biology major, and suddenly I had a lot of trouble doing my reading. I had a lot of trouble writing my labs. There was a lot of reading, a lot of writing to do, and for the first time in my life, I started to struggle with my schoolwork. My social anxiety started to increase, let's say like tenfold. I started to break off dates and appointments with friends. I started to skip classes more frequently. I just found I couldn't be out in the world. I started to struggle facing people and having normal conversations. By the middle of October, so school starts in September, by the middle of October, I'd broken up with my boyfriend, because I didn't want him to call me anymore. I distanced myself from all my friends. I was no longer returning their phone calls or their emails, and I had stopped going to classes altogether. Basically, I was numb. I wasn't curled up in a ball crying. I wasn't depressed in that I was sad and crying all the time. I just felt numb. I didn't feel anything. I didn't feel happy. I didn't feel sad. I was just empty. Really, the only thing I did feel was desperate because time kept passing and the problem didn't get better. So this went on for months, where I just couldn't bring myself to go to class. And my life basically became a big series of lies. Because I lived at home in Dartmouth with my parents while I went to university. Every morning I'd wake up, get in the car with my sister, drive over to Dal. She'd go off to her classes, and I would go hide. I had a corner on the 8th floor of the Life Science Center at Dal where nobody knew to look for me, nobody would walk by. I sat there and I just hid for the entire day. I still did my work. I was still doing my physics assignments and my calculus assignments and handing them in after class, but I just couldn't bring myself to go to the classes or the labs or the tutorial sessions, so my marks started to drop tremendously. At the end of every day, I would go home and my parents would ask me how school was, how was your friends, and I'd say, fine, everything's fine. But in reality, I wasn't seeing anybody, I wasn't doing any work. And it went like this until December. So from middle of October through to December before exams, I told lies every day and pretended to go to class. So I was a smart girl. I knew that there's ways to get help. I knew my family loved me. I knew that if I spoke to my family about this, that they would be supportive and they would help me. I knew there was 911 and helplines and counselors at Dal. I knew there was all these people to go to, but I couldn't go to anybody because basically I was too ashamed. So I like to say that I almost died of embarrassment because instead of going to get help from anybody, I tried to kill myself. Sorry. So it's a typical story in that I went to my family doctor and I told her a story about I couldn't sleep. I was having a lot of trouble sleeping. And she didn't want to give me any prescription sleeping pills because a healthy 21-year-old girl shouldn't really need prescription sleeping pills to sleep. But I was a very convincing liar, so she gave me the pills, and I left her office. But I was worried that they weren't enough. So I went to the pharmacy, I got the prescription filled. There weren't a lot of pills. So I also went and bought some over-the-counter sleep aid. And I thought together, the combination of those different pills together would be enough. I went home, I had a normal evening with my family. The next day I woke up and I again told a lie and told my family that I was sick and I was staying home from school. I told them I loved them and they went off. And then I wrote a note. And in my note, I wrote basically everything that had been going on, that I hadn't been going to classes, that I'd been telling lies through this whole time. And then I went upstairs and I cleaned my room, because I didn't want to leave a messy room, and I stripped the sheets off my bed, because I thought I might soil myself when I died, and I didn't want to ruin my mother's good sheets. So you can see, I was really logically thinking through everything. To me, I had thought through all the options. I had come up with this plan, which to me really was the best plan. In my twisted, mentally ill mind, I thought it'd be better for my parents that I was dead than them have to deal with a daughter who was failing university and who couldn't cope with daily life. So I went upstairs and I took all the pills and I downed it all with a big bottle of rum and I laid down to die. And I should have died. I took enough pills and I drank enough alcohol to stop my breathing. But my sister and her boyfriend decided to take the afternoon off university and came home and found me. So I woke up at the Dartmouth General, so where you guys all work. I had a tube down my throat, my stomach had been pumped full of charcoal. And immediately I started lying again. I told everybody that I was fine, that this was all an overreaction. I know that it was a mistake. I'm happy to be alive, and I started lying. And I was diagnosed with, I wasn't seen by a psychiatrist. Actually, talks like today are the closest I ever have gotten to psychiatrists. So I'm sorry they've left, because it'd be great to talk to one of them. But I wasn't seen by a psychiatrist. I was seen by a resident in the emergency room. And I was diagnosed with situational depression, which basically meant that I tried to kill myself because I was failing school, which was true in a way, but it didn't address what had led up to that, what had gotten me to the situation where I had tried to kill myself. Why had I pushed away all my friends, why I couldn't go to any classes anymore. And I wasn't kept overnight. I was discharged to my parents' care and recommended that I see a few sessions with a psychologist. So my mother had organized 6 sessions with someone who she knew. I went to those sessions and I did not do the work. I didn't want to be there. I started lying again. Basically, all I wanted to do was cover everything up. And that's what we did. We never talked about it again. My mother made me sleep with her for a couple months afterwards because she was so scared something would happen to me, but we didn't talk about it. And she's actually a nurse who's worked in psychiatry, but she just couldn't deal with a daughter who was going through a major crisis. I never saw my family doctor again. I got a new family doctor, so I never spoke to her again. And after those initial sessions with psychology, I did no further therapy. There was no medication. So basically, I just tried to sweep it all under a rug and carry on with my life. And nobody outside the family knew either. And recently, since I've called this my coming out of the mental health closet. So now that I've started speaking about this and I'm telling people what happened, a good friend of mine who was one of my best friends in high school and through university said that if she had to have picked somebody in university who was the strongest, most together person she knew, she would have picked me. And this was during the time that I tried to kill myself. So no one had any idea what was going on with me. So basically we just kept it quiet. So I managed to pull myself together and went back the next year and finished my degree. And this is where things in my life took quite a turn, because I'd always intended to go to medical school. I always wanted to be a doctor, and I had taken the right courses, I had gotten the right marks, but I didn't even apply because this final year of university was such a struggle for me. I knew that there was no way I was ever going to get through medical school and be intact. So instead I packed my backpack and I started traveling. So anyone here follow professional tennis? We got one couple, and it's too bad Rudy has left because I used to play tennis with him, actually, so I know he's keen. So rather than backpacking through Europe, staying at hostels, I told you I used to play tennis and I used to coach tennis. I also had become very involved in tennis officiating. So this is a screenshot from the Australian Open, which takes place every January in Melbourne, Australia, and that's me in the chair. So I actually joined the Professional Men's and Women's Tennis Tour as a chair umpire and referee, and traveled full-time for 6 years with them. So it got me away from home. It was a good paying job, and really had no life stress. So little snapshots of my days. That's me in a Wimbledon uniform there. And my time off from work was sweet because I didn't have any concerns at all. As I said, I was staying in a hotel room. People were cleaning up after me. I didn't have, bills to pay. My hotel room and airfare was all being paid. It was pretty good. So on my vacations, I had a season's pass out to Whistler. I would go out there and ski for a few weeks. I was an avid scuba diver. I would dive on the Great Barrier Reef for a couple weeks in between different events. And so I was actually living a really, really good life. But it wasn't reality. There was no sort of real life stress involved at all. And the other thing that worked really well in my advantage was that I was out in the sunshine almost every hour that I was awake. And I was doing a lot of physical activity. So you guys are all medical professionals. You know, the serotonin, the norepinephrine was coursing through my brain. And basically, I was self-medicating through sunshine and exercise, which I didn't realize at the time. I thought I had put everything behind me and everything was okay. So when I retired in 2001, I was the 5th-ranked female umpire in the world, and had worked all of the major tennis tournaments, including the Sydney Olympics and Paralympics. I came home because I met my husband Scott and decided to get married, so we got married in 2003. Our first son, Callum, was born in 2005, and our second son, Ewan, was born in 2007. And basically, through this entire time, I was like a pressure cooker, because everything started building up again. I was working at the hospital full-time. I was looking after 2 babies. I was getting them to daycare in the morning. My husband's a lawyer. He works long hours. Basically, I was the sole caregiver for these 2 kids. And things started to build up, and suddenly I found that I was suicidal again, and I was terrified. Because although I had been through it before, I hadn't learned anything from it. I didn't have any coping mechanisms. I didn't have any skill set to call on. I didn't know what to do. The only thing I did know was that I had 2 babies to look after, and killing myself was no longer an option. So I took myself to my doctor, and this is the new doctor that I got in my final year of university, and she had no idea of my history. She was my doctor through my pregnancies. She had no idea until I showed up in her office, basically became a puddle on her floor, but she was fantastic. She immediately diagnosed me with a major depressive disorder, started me on medication, and got me into a therapist who I connected with, and I started to do the work. So things got better. I was no longer suicidal. But things didn't get great because, unfortunately, I was treatment resistant. So over the next 6 years, we tried numerous different pills, different combinations, different doses, and this is what I felt like basically every day at work. So I'm a classic example of the term presenteeism. And you guys familiar with that at all? It's when you're not absent from work, you are present at work, but you're physically present and emotionally you're disengaged, mentally you're disengaged. So I was going to work and probably working at about 60% of my capacity. I was seeing all the patients I had to see, I was getting all the work that I had to be done, but I wasn't putting anything extra in. I wasn't able to give it my whole self. And I was coming home at the end of the day, and I was putting my children, getting them fed and putting them to bed, and I didn't enjoy them very much because basically they were exhausting, right? I had 2 little boys who were very busy, and I love them to death, but they wore me out. And so everything just kept building and building. So as it was mentioned in the introduction, I'm a bit of a writer, so I always wrote to myself in letters. And this is an excerpt from a letter that I wrote to myself in 2014, and it wasn't meant to be a suicide note, but it says, "I'm physically and mentally tired. Worst of all, I'm tired in my soul. I feel empty and devoid of hope. Considering that both my sister and mother were diagnosed with cancer this year, I should be thankful for my life and my own good health. Instead, I feel cheated. I'm the one who wants to die. Why can't it be me hosting the lethal mutating cells?" And this was true. My sister had been diagnosed with breast cancer, went through a bilateral mastectomy. My mother was diagnosed with uterine cancer, and I thought, that's not fair. They are these wonderful women who want to live. I'm the one who wants to disappear. Why isn't it me who's facing a lethal diagnosis? Just for the note, my mother and sister are both doing very well. So sometimes people get worried about them if I don't mention that. So I didn't really, as I said, I didn't mean this to be a suicide note, but one day I called up my dad and I said, can you pick up the kids after school? I've got some late meetings. And that was a lie. I had actually already called into work sick. And all I knew is that whatever happened during this day, I was no longer going to be in the position to look after my kids. So I just found myself driving around, and I ended up stopping overlooking a cove off of Herring Cove Road at a scene that was just like this. It was actually January 2nd in 2014. And it was a bitter, bitter cold day, and I found myself standing on the rocks. And my plan was to walk in and either drown or crawl back out and lay in the woods and freeze to death. And that either way, my kids would be able to told it was an accident, that mommy died of an accident, that not. When I was thinking about my children, that I sort of came to. She immediately took me to the emergency room because it was an emergency. And I got in immediately. So the great thing is if you go in and tell them you're ready to kill yourself, you do not have to wait. You get right in. So I was seen immediately, still not by a psychiatrist. The emergency room doctor, who was fantastic, set up medication change, things like that. I actually went in and asked for electric convulsive therapy. I was so desperate that I tried so many different medications, different combinations, that I thought, I need shock treatment. And they sort of agreed, but they said, let's try one more thing first. And so they gave me a little pill that was an antipsychotic, but it was actually being used off-label at the time, being used for people with depression in combination with their depressive medications. And so I took that, and within the week, I felt amazing. And I see some people here wearing glasses. Do you guys remember the first time you got your glasses and all of a sudden you realized that not everything in the world was blurry and that other people could actually see the leaves of the trees? Like, I remember the day when I got my glasses, I was like, what? People can actually see leaves? And that's what I felt like, because suddenly I felt good and I realized that most people feel this way, right? Not everybody. We've already heard, and it's 1 in 5 Canadians will develop a mental illness in their lifetime or addiction problem. So not everybody feels good, but most people do. And so suddenly, I felt the need to tell people about it. So you heard in the introduction that I have this blog. It's called Escaping Elegance. And really, up until this point, it was a blog about my kids and my life, and nobody read it. My parents read it, and my coworkers read it, and people who knew me read it, but nobody else. But I decided I no longer wanted to keep my mental illness a secret, because up to this point, the only people who knew that I was struggling at all or was on mental or depression medication was my husband and my sister. Nobody else knew. My parents didn't know. I was worried my mother would want to come sleep with me again, right? So I didn't tell anybody. Nobody at work knew. When I had a therapist appointment, I went to the dentist. I think they think I have terrible teeth, because I was always going to the dentist. But anyway, so I wrote this blog post. And in it, and you're not supposed to be able to read that, so don't even try. But in it, I wrote about my past suicide attempt. I wrote about my current suicidal tendencies, my use of medication, and basically told my whole story. And when I hit post on that article, that's how everybody found out. That's how my parents found out. They read my blog the next day. And basically, it was like ripping off a Band-Aid, because everybody I knew instantly now knew the secret. And my mask was shattered. So I came out of the mental health closet. And nobody now questions when I have to take a mental health day. I now will admit when I'm having troubles. I now am speaking openly about it with everybody, apparently. But the best thing that happened was that my blog sort of went a little viral. It won a blogging award in that it got picked up and named as the post of the day. And so instead of having my normal 100 readers, suddenly I had 5,000 readers in one day. And I started to get hundreds of emails and comments. And people told me the most amazing things. A woman told me that reading my story helped her understand why her daughter had killed herself in university. I had people tell me they now understood why their spouses acted the way they did when they were sick. And then I had people from my own life, people who I hadn't spoken to since high school, come forward and tell me about their own struggles and how they wish they'd known what I was going through when I was going through it. So it opened this amazing world. And the more it opened up, the more I realized I had to keep talking about it. So basically, I like to say that I once had a secret so shameful, I swore I would never talk about it, and now I can't stop. Because now, in the past winter, I've given 15 talks at area high schools. I've been fortunate enough to be invited last year and this year to talk at the medical school, to all the classes, at the law school, different universities, things like that. And while you guys are really important, you're not my most important audience. My most important audience are those young people who are going through what I was going through, and I didn't hear that it's okay to need help. I didn't know that it's okay and that you're not alone, and so I'm trying to tell them. And in my very first, it was actually at Dartmouth High School, my very first high school talk, I had a student come up to me afterwards, asked to speak to me privately, and told me that she was suicidal and had plans made, and I was the only person she felt she could tell. So it's from her. Every time I go out and talk, I think there's one person in this audience who needs to hear what I'm saying, and I speak to that person, and that's what I go on. And the other thing that it does is it helps keep me very honest about my own mental health. And it helps me look at myself every day. And I'm actually going through a really hard time at the moment. Just this week I've had to take a short leave off work. And today's a beautiful sunny day, but winter in Nova Scotia is usually pretty crappy. So winter is a pretty bad time for people who are suffering from mental health issues. I've just this week had an increase in one of my medications, and finally have gotten referred to see a psychiatrist. So hopefully in the next couple of weeks, because I've been marked as pretty urgent, so I'm going to get in to see somebody. So because you're wondering what those little babies look like when they've grown up, those are my boys. And my email address is down there. It's reedy.steph@gmail.com. And I've been very, very open and personal with you guys. I've told you probably more than you really want to know. But I'm also willing to answer any question, no matter how personal as well. But if there is something that you want to ask me or a comment that you'd like to make that you do not want to make in front of the group, please email me, because I'd rather you reach out to talk to me than not. You're never bothering me. Okay? Any questions? Sorry if I made you cry.
I tried everything.
Oh, okay. Any questions? No? Oh, yes?
So, again, if this isn't too personal, was your main diagnosis depression?
Yes, so the question is, what was my main diagnosis? Yeah, it was a major depressive disorder, but I go through so after my children, I had postpartum depression. So this second time I felt suicidal was literally the month I went back to work after my second pregnancy. I was back working full time. I had to stop breastfeeding, so my hormones were in flux, and everything sort of came crashing down. I also am affected very, very strongly by seasonal affective disorder. I have a sun lamp on my desk at work, which helps a little bit, but it's hard to combat how dark it gets around here. So basically, I need to move back to Boca Raton and live in the sun. But my husband doesn't agree. So, yeah. Anyone else? Yes, right there. So the comment or question is that as somebody who's living with a child who is suffering like this, what would my advice be? A grown adult child, yes. That's me, I'm a grown adult child, right? So basically, the best thing you can do as a parent in this situation is to be there and listen to them and be supportive. hopefully they are being treated, because your number one goal when somebody comes to you in distress is to help them get help, because you're not in a position to offer that help yourself. So you want to make sure that you help them by getting help. So hopefully they're being treated. And then you want to be a partner with them through that treatment. And you want to be supportive with them, understanding that when they're telling you something, you have to accept it with an open heart and an open mind. I know it's hard as a parent when you want to immediately say, oh, but that's okay, you'll be fine, honey, you'll be fine. But sometimes you do have to just listen and accept that, yes, I know you're feeling like your life is pretty crappy right now, but let's work together and hopefully it'll feel better. So does that answer it all? Sort of. It's a hard one to answer because everybody's individual, but the main thing is to be a supportive, loving parent, which is probably your first instinct anyway. So, yes? Yes? Go ahead.
I was just wondering, it seems to take a long time before you were contact with a psychiatrist. What is it you've heard about it at the very beginning?
So the question is about why it's taken me so long to be referred to a psychiatrist, and a lot of it's my fault, because I like to try to solve my own problems, and I'm in denial about everything. So it takes me a long time to come forward and get help when I need help. And the other part is that my family doctor is fantastic. So she's actually been in liaison with several different psychiatrists. So I have gotten medication recommendations based on my care from different psychiatrists. I just haven't physically seen anybody myself. So I've just sort of come to a crossroads now where we've sort of maxed out all my treatment and I'm still feeling really low. So now is the time when I'm going to go see somebody, and we are going to talk about electroconvulsive therapy. Yeah. Yes?
It's kind of something I wanted to ask you. You talked about feelings of numbness kind of thing, and you are on medication now. Do you find that the medications are just like another form of a mask, or to keep you going kind of thing, or are you experiencing joy as your mood uplifted,
Yeah.
or is it just another?
So the question is, on medication, is it just acting as a mask, or am I feeling well? And when my medications are working, I feel great. And I consider myself to have, because we have to remember that, the same way we all have physical health, we all have mental health, and mental health is separate from mental illness, right? So you may not have a mental illness, and the only way you know if you have a mental illness is if you've been diagnosed by a doctor. So you may not have a mental illness, but you still have mental health, right? So I have a serious mental illness, but I also, at times, have really good mental health. I can also have really poor mental health, but they're on two different spectrums. So right now, my mental health is slipping down a little bit, but when it's good, it's great. Yeah, no, it's when my medications are working, I'm just as active and involved and enjoying life as much as possible. So unfortunately, some people don't like medications. Personally, I'm a big fan of them. I've done the therapy as well, but I've therapied myself up the kazoo, and now I'm done. But medications, to me, I take 3 medications every day, and to me, it's the same thing as if I had diabetes and I had to take insulin every day. My body is lacking certain chemicals, and those chemicals need to be augmented or replaced by medication. And so that's the way I think about it, and if I never miss a day. Yeah. Yes?
Do you find after doing all your talks at the schools that it's surprising how many young people are suicidal?
So the question is, am I surprised when I'm doing all my talks at the schools about how many young people are suicidal? And it used to be surprising. It's not surprising to me anymore, because no word of a lie, after every one of my talks, I have someone come up to me who tells me about a past suicide attempt, or how they've been feeling suicidal in the past, or that they are currently in crisis. So it's not surprising, and I think that's why schools are now moving toward having mental health professionals in the schools, right? They have certain schools I've gone to talk to actually have counselors who are devoted strictly to mental health. They have got Dartmouth High has a nurse, a mental health nurse, who visits, I think it's once every couple weeks or something. So I think the response is that I think you can be surprised if you don't know what's going on, but if you're there with the students, then I think it's not a surprise, because everybody thinks your life is pretty easy when you're a teenager, but it's really hard being a teenager. Yeah. Yes?
I just want to say how brave and courageous I think you are for coming up and talking about this and making it okay. And anybody else here that is feeling anxiety or depression, that it's a normal thing, that it's okay to talk about it.
It is okay. And thank you for thanking me. And the other thing I just want to say is that anxiety, although it's normal, it's also very healthy, right? Anxiety is what helps me get up here and do a good talk, is because I get that stress and the butterfly feelings before you do your talk. So anxiety is a normal, healthy thing, and stress in our lives is a normal, healthy thing. So it's how you deal with it which determines how well your mental health state is going to be. And so what you want to think about, two major points. I'm not going to give you a mental health lecture, but two major points. One you want to think about for yourself as well as your friends and coworkers is change. So is there, and your children, right? So is there a major change in their behavior? Have they gone from being an A student to a poor student? Are they skipping classes? Have they distanced themselves from their friends when they used to be very socially active? And the second thing is just slipped my mind. No, there was two. So the first thing is change. Oh, and the second thing is the duration of how long you're feeling poorly. So if you're feeling bad, it's all normal for us to have a bad day if we, had a fight with our spouse or we had a bad day at work. But if you're having bad or negative feelings or feelings like you wish you were dead or that you want to hurt yourself and it's lasting over 2 weeks, right? Then that's when you need to seek help, because that's a good sign that you are going through a mental health crisis. So those are your two things you want to look at, is change and the duration of your symptoms. Okay. Any other questions? Yes?
Were your parents surprised when they looked back, not knowing after years of suffering? When they found out, were they...
Were my parents surprised? Yes, they're very surprised and in shock. And but they're fantastic, right? My parents are great, and I've since learned, since I've started talking about things and being more open, that my mother has a history of depression and had a breakdown when I was a young child, but I didn't know that. So we're talking about, Dr. Harris talking about, it was Rudy who was talking about family history. It was always not spoken of. It was a taboo subject, and so that's why I think it comes as a surprise to people. But once you start talking about it, it's amazing the number of people that come out and tell you their own problems. So it's no longer a surprise to them. And on that same note, I try to be very open with my kids. They're only 11 and 9, so I haven't spoken to them about that I've tried to kill myself. But I do speak about Mommy having problems and gets very tired, and sometimes she needs to go to bed, and she takes medication to help her feel good. And so I'm very open with my kids about that. So it won't come as a surprise if something ever arises in their own history. Yeah. Anybody else? Yes?
One of the viewers wants to know your medications that you're on.
Okay, so one of the viewers wants to know which medications I'm on, and so I will tell you, because I'm fine with that, but you have to remember that medications are a very personal thing between you and your doctor, so what medications work for me might not work for somebody else, and don't take this as medical advice at all. So I take Wellbutrin, 300 milligrams. I'm on duloxetine, 30 milligrams, and Abilify, which is the antipsychotic, and that has just been increased this week to 5 milligrams from 2 milligrams. So, yeah. Yes?
Do you ever have anybody ask you if you're fixed or better, or when will you be better?
Yeah, so the question is, will I ever be fixed or better, basically? Or do people ask me that? And I think people who are going through the problems themselves sometimes want to know, will there ever be a point? And unfortunately, depression is something I'll always have. And it's something I'll always live with. The same thing, I'm going to use the diabetes example again. If you have diabetes, you'll always have diabetes, right? So it's something that I'll always have. my hope is that I'll get to a point where it's really stably managed and that it won't become a focus. And usually it isn't a focus of my day. Only when I'm going through a problem does it become the same thing. And you know what's interesting is that, people with depression or mental illnesses miss the same amount of work as somebody with a heart problem. So, I don't take more sick time than anybody else. It doesn't affect my life. I'm still working full time. I have great kids. And so depression is just a really small part of who I am. There's much bigger parts of who I am and much more important parts. Yeah. Yes?
How did you feel after, would you have postpartum depression, like when you had your children? When the hormone changed, did it intensify your depression?
Yeah, so the question's about postpartum depression, and I did. So after my first child, I kind of went a bit crazy in that I exercised like mad. I trained for the Blue Nose Marathon. So I think I was combating my postpartum depression then again through exercise. It was after my second child when I crashed. And everything came together there. It was exhaustion because I was really tired. Brain chemistry was changed because I had to stop breastfeeding, back to work full time, so there's the stress of that. And it all combined together, and the postpartum depression really did. So that was my second time. I felt very suicidal, and I contribute that mainly to postpartum depression, for sure. Yeah. We all asked out? Okay, thank you.